We are one of the co-leaders for Data Across Sectors for Health, the National Program Office for DASH. So this is our final cross-cohort webinar. If you can take us to the next slide. While everyone is joining, so here's a quick rundown of what we plan to do. We'll do a quick icebreaker in the chat, share a couple reminders from the program office, and then we will pass the mic to our friends at Elevate Health that will be presenting on today's topic, sustaining your work through community engagement and aligned funding. And then we hope to have a little bit of time at the end for some dialogue, and there'll be a few interactive active polls as we go along. So if you can go to the next slide. I want to point out that Susan asked in the chat for our icebreaker. We ask you to share your name, your organization, and then either a win or a lesson learned or some kind of quick highlight from your time with the mentorship. And we will start to pull through those and share them out as we go along. So if you're having any technical difficulties during the next 75 minutes, you can message, chat, or email Susan Martinez. Next slide. Here's our team. The program office is really here to support the execution of the program at large and navigate any questions around contracts and just sort of program structure. We work closely with the mentors. We also are the ones who administer the evaluation. And as we kind of face the end of the program here in the last few months, we are especially interested in hearing lessons and success stories that we can amplify and lift up from the impact you've had at the ground level. Next slide. Oh, before I go to the next slide here, I wanted to just acknowledge Susan and Miriam as really the key support staff, and especially Susan for helping make this program a success this year. I know this is our final cross cohort, but she's done an amazing job helping us innovate, try new things. You know, these cross cohort webinars were really a new effort that we did not have in place last year. And we know we've gotten some feedback from some of you about what works and what we could do different next time, but just want to say shout out to Susan for all her hard work on this program over the last year. Next slide. So just to kind of ground us in why we do these cross-cohort webinars, the idea is that this gives you an opportunity to meet some of the other mentors that you're not directly connected with, hear a little bit about their practice and their expertise, also to connect with and meet the other mentees across the other cohorts. And these sessions are open to you and your partners, anyone that you think would be interested in the topic. We do record them and make them available for you to share and pass on. And then, you know, the content is sometimes might not be relevant to where you are in the moment with your local collaborative work, but might give you ideas, tools, resources to kind of come back to later with your mentor and or with your local collaborative partner group. Next slide. So the award ends the end of December. Prior to us, some of you might recall there is a final check that goes out at the end of the project. So in order to receive that, you have a final evaluation survey. It's very similar to the survey that you recently completed for the midpoint. And then just a very short kind of budget report of how you allocated the funding. So those final evaluations are due prior to the end of the year so that we have enough time to get the payments out. We will send out that evaluation December 1st, so give you a couple weeks there to complete it. And other than that, there aren't, you know, a lot of documentation requirements. We do, for those of you that, you know, feel like you've had some traction, even if it's just one thing where you were able to get some new partners to the table, come up with a shared use case, even execute an agreement with the vendor or develop a data sharing agreement. All of these are things that we love to hear about, and any kind of products that you've created that you have made publicly available or not, we would love to have copies of those as well. We can go to the next slide. Great. So, gave a shout out to the program staff. Want to also give a shout out to the mentor teams, CORE, University of Pittsburgh and Drexel, San Diego 211, United Way Worldwide, Elevate Health, Corporation for Supportive Housing, and Civic Canopy. And we have some really great staff that put in extra time and support to work with all of you as mentees. And thanks to all of you for participating in the program as well and making yourself available to share insights with the peers in your specific cohorts. Next slide. Okay, so just a few little updates here from us. Some of you we know have been participating in the All-in Affinity groups. These are also winding down in the next month. If you are in an affinity group, you'll be getting an email to please complete an evaluation. This is helping us plan for the next launch next year. Secondly, if you're coming to the All-in National meeting, we will have an affinity group networking session to just sort of brainstorm ideas for future topics and facilitators for those groups. And then if you want to stay up to date on when they'll be announced, just make sure you're on the All-in newsletter and that you join the All-in online community. Next slide. Great, and here, some screenshots of the online community where you can there's a subset of the mentor groups, and then also the best way to post and ask is through that general discussion forum. Latest discussion, that little green box ad is where you post an announcement, but it's very easy to sign up. Next slide. Okay, and then we have Dash has 2 funding announcements that are out right now. One is our second round of LAP, $80,000 awards to 5 awardees over the course of the 7-month period to coordinate efforts around partnerships for COVID relief funds. So this is really about how do we invest in partnerships and local data systems to make use of the federal investment. And then the second one is a new opportunity for us. This is called the ABCD cohort, asset-based community development. Some of you might be familiar with this. We are super excited because we're going to be partnering with the ABCD Institute based here in Chicago with the DePaul University. And this is really targeted to CBOs that are looking for some coaching and support around, what data assets they have and how they can advance this work in their local communities. So that informational webinar info is there, and that's the place to find out more about that opportunity. Any questions specific to those should be directed to that info@-connect email address. Next slide. And I think we have one more announcement, and then I'll kind of run through a couple of the comments in the chat from the icebreaker. So the All-in National meeting is coming up just in 2-3 weeks here. We just want to do one final push. If you'd like to sign up for any of those pre-conference sessions, those are 2.5 hour workshop skills building. CORE is actually leading one of those, as well as some CBOs. So really excited about those. And then you do have a free registration code, so just make sure you have that from us. And if you can't use it, I'm sure we can make arrangements for your partner or your colleague to take advantage of that. All right, is there one more slide? All right, so this is where I will take a minute to read out some of the notes from the chat. So just bear with me here. So we have Elizabeth, Liz, with United Way of Central Jersey, late in the game to joining the Dash mentorship, but learned so much about creative ways to gather data and evaluate data. Cool. Caitlin with Action Health Partners in Washington, I believe, with the ACH. We have learned a lot about how to communicate our data and purpose for our project and creative ways to engage our community. Cool. We'll be talking more about that today. Robin with Community Health Associates in Marietta, Ohio. The mentorships help us refine our data and helped us better utilize it. So it seems like there's some continuity here. We have Amy with United Way of Southeastern Ohio. I've learned that literally everything successful starts with relationship building. Very true. Let me grab just one more here. We have Charles Dwyer with the Maine Health Access Foundation. We've got a terrific cross-sector CIE work group and has good participation. And our lesson learned is that this is about building trust and relationships more than technology. So that pairs really well with the previous one. We'll come back to a couple more of those, and I encourage you to read what folks put in the chat and react to it. So I'm going to pass the mic now to John, Lauren, and Laureen with Elevate Health. Thanks, everyone.
Hello, everybody. I hope everybody can hear me okay. I'm in a coffee shop, so there may be a little background noise, but my name is John Levi, and I'm the Community Engagement and Diversity, Equity, and Inclusion Manager with Elevate Health. And had the privilege of leading this cohort, and it's been wonderful. And today we're just going to talk a little bit about community engagement strategies. I've been talking with my mentor group a little bit about it, but we haven't dived too deep. But today we're going to give a nice overview, and feel free to, ask questions in the chat, raise your hand, unmute. I'm very interactive, so that doesn't bother me. All right, let's go to the next slide, please. Elevate Health, their core values are community, empowerment, equity, inclusion, integrity, innovation, and reverence. The reason why we want to share our core values is because in the midst of you guys' community engagement endeavors, the community, whether it be your partners, whether it be individuals from neighborhoods, they're going to want to be able to anchor something, anchor themselves on something from your organization. And your core values are a great place to start. So if you haven't developed your core values as an organization or, as a project, I would encourage you to, do that. Come to some consensus, do some brainstorming, some team gathering, but come up with your core values. That's really going to help to strengthen your community engagement efforts. All right, let's go to the next slide. I think we have a poll.
Yep. I'm going to launch the poll now.
Okay, we're going to have a poll, and just go ahead and think about, is community engagement a priority as a strategy for your success? Yes, in practice. Yes, in theory. No, but in practice. No, but in theory, not at all. Take a second to think through those, reread it, and log your answer. Take about 30 seconds. About 10 more seconds. Susan, hopefully they're capturing their answers.
Yep, we've got tons of participation. It's not too late.
Excellent.
For folks to answer.
Take about 5 more seconds. Go ahead and log your answer in so we can get some good data. 3, 2, and 1. All right.
Are you seeing the shared results?
Yeah.
Great.
Hopefully everybody can see this. This is a good opportunity to see what our group is looking like around community engagement as a priority. 57% of you said yes in practice. 37% said yes in theory. 3% said no, but in practice. 3% said no, but in theory. 3% said not at all. I appreciate your honesty. And in our next slide, we're going to unpack a little bit more of why this is important and why you can fall into different levels of this. All right, go ahead and go to the next slide, please. So your theory, okay? Your theory is what you believe about the community, okay? In a sense, this is your philosophy, what you believe about people, the area where your organization is located, the areas in your county, your state, your city of which you want to serve. What do you believe about that area? What do you believe about the people that live there? What do you believe about those businesses? What's your philosophy behind it? This is a critical step in your strategy. Now you get practice. Okay. In your practice, this is your policy that guides your theory. So your theory, you have how you think about the people. Your practice is then, okay, what are we going to do? What type of actions? What type of daily actions are we going to do that really guides this theory into some practice? And then ultimately you want to move to operations. And all of these are working simultaneously. So operations is the internal functional structure that standardizes, supports, and holds you accountable to your practices and theory. See, now we can go back to that poll. You see, it's one thing to say, well, yeah, in theory, we do community engagement, or it's a priority. We really value the community's input. That's in theory. That sounds great. 100% of all organizations could say that. And then you go down to practice. Is that theory matching up with the practice? Could you go to the daily practices and how they run their grants, how they facilitate meetings, how they invite the community in? And are those daily practices lined up with that theory of what we believe of the community? But then the organization has to make it functional. The organization has to make it a part of their daily decision, their process, the board of directors. They're rolling out a grant process. It has to all start to line up there, and your operations is where you're going to really back all this up. Because in the back office, when things are written in policy, when things are standardized, it allows your theory and your practice to go through that mechanism, and it spits it out just like a computer. So any program, any idea that you have is going to run through this process. And I believe when you kind of have all this set up, then you're really functioning, I think, at a good level to employ whatever community engagement activities you want to do. Okay. But theory, what do you believe about the community? Okay. What practices undergird that theory? And then internally, do you have the structure to standardize this theory and practice? Any thoughts, any questions, anything that stands out to you when you see this? Maybe you've seen it before. Probably it's nothing earth-shattering, but just something that Elevate Health really believes by. So go ahead and go to the next slide. And feel free if you have, yeah. Thank you, Natasha. So with that, think about the previous slide. We have our theory, we have our practice, and then we have our operations, okay? So within all that, you wanna have alignment, okay? You want to know your why. Why are you doing this? For Elevate Health, I'll use a very specific example. We have something that's called a community advisory council. And that community advisory council is designed to take information from the community, feed it up the chain to Elevate Health so that we know what's going on the ground so we can make decisions, okay? So why? Why do you want to do community engagement? Is it to check the box? Is it to really get to some community-led initiatives? Why? And after you know that, then you can figure out who you need at the table to make that happen and who you don't need at the table. I think that's a very critical thing. I think, in the spirit of wanting to include everybody, I think when you're very focused on what you're doing, there's an alignment. And so you don't have to try to bring everybody on. You want to bring alignment on board so you can have synergy in what you're doing. And that's not discounting anyone. Please hear me on that. It's about alignment. Alignment is very, very key. Because let's say you want to start a community wellness fund, which, Lauren will talk about. Let's say your focus is like, yeah, we want to do this, this, and this with the money. And so you go reach out to partner because you're like, yeah, it's a no-brainer. Of course, people are going to want to give money to this. I'm using kind of an example for one of my mentors, but they're like, hey, we already give money. We already have our setup. Why we want to be a part of yours? Our name's on this. We make decisions. We like it. It's like, oh, okay, good point, right? Alignment, very important. Oftentimes, you may find better alignment with smaller organizations, smaller entities that are not tapped into the bigger system. Sometimes they're a little bit more easy to align because they're looking for some support. Your workflows, your partner workflows, essentially this is your charter. What's the nature of relationship? You got to understand that. Community-based organizations are going to be key in your community engagement efforts. One is because they typically, have staff that are from the community. Their mission is directly tied to serving a specific demographic in the community. So when you want to hone in on any population, your community-based organizations are going to be kind of who you want to go to and maybe who you want to bring to the table. Again, like I said, align insights, activities, workflows, and scope of influence. Okay. What are the people going to be doing once you engage them? Are they going to be filling out surveys? Are you bringing them to the table to make decisions? Okay. What are they going to be doing? Next slide, please. I want to share a model. This is what Elevate Health is embarking on. A minute ago, I mentioned about our Community Advisory Council. It's known as the CAC. My mentor group has heard me talk about that. The rest of you may have not. But what you'll see here at this bottom tier, the community tables. This community tables, there's 4 of them, okay? Community-based care coordination, workforce development, social determinants of health data platform, and community resiliency. Okay, these are steering groups, community tables. The goal here is this is the grassroots community level. This is where if people are interested in these various topics, they can sit on these work tables. They can bring their ideas. They can bring what they're hearing in the hospitals, on the streets, and in encampments. They can bring it back to this table for it to be heard, for it to be elevated. Okay, so this is that community level, the steering groups. Okay, this is where information, if you see coming at the top of the steering groups, it's going up. This is where information comes, gets aggregated, gets fed up the chain to the regional advisory panel. Okay, now this level is consisted of the integrated managed care groups, provider integration panel, regional learning collaborative. So these are a little bit higher level professionals, people that are a little bit higher level into some of these systems. Okay, so they take the information that's fed up from the community. Okay, now that RAP, regional advisory panel, can take that information, look at it, and say, okay, yeah, this okay, yeah, okay, we've seen this multiple times, we've heard that. All right, hey, executive leadership team, we're noticing this is kind of a trend here. What do you think about that? Let's feed it up the line. So the executive team now gets to take a look at it. If they see fit, they'll run it up chain even higher to the board of directors. Okay. Then that information can flow back down through the executive leadership team, down to the regional advisory panel. And then the community group will then kind of find out what happened with the information. And then it's a feedback loop. So it's this constant cycle of information coming in from the grassroots, going up through the chain, vetting it to see, okay, is this in our wheelhouse? Is this mission critical? No, yes. All right, now let's feed it back down to see what type of solutions they have. How do they want to solve this problem? So this is really kind of our community engagement strategy taken to a deeper level because we want to bring more people to the table. We really want people from Pierce County, from all sectors, to really gather with Elevate Health. If we're going to be a true convener, we want to bring everybody together and get information so we can make the right decisions so that the health of Pierce County is truly transformed by a good system, by a new system. So yeah, take a look at that, take a picture, jot it down. But want you to see this. This is kind of community engagement strategy taken to a new level, really built up into our internal structure. Again, because like I said, operationalized. So community engagement is great if you do it one-off every now and again. You go to some booths, you reach out to your community. But when you embed it into your internal structure, you're going to have a higher return. I've heard some of you talk about trust. Everything successful begins with relationship building and then trust. It's so important. And I think this is an opportunity with this model is to build some trust with the community in our organization and to have a true feedback loop. All right, I'll pause there. Any questions? Anything anybody wants to highlight, concerns, comments? Got about a minute or so before we go to our next slide. Anything?
John, I
Anything
had a
cropping
question.
up?
And if
Yes.
someone else wants to jump in, can you give us an example of when like board of directors or the executive leadership team kind of don't see the issue as mission critical? Or how does the community table, do they feel like that the RAP always advances the things that they're elevating on the ground? Or is there a lot of stuff that doesn't make it up, even up?
100%. So I'll tell you, in our current structure right now, Anna, this RAP advisory panel is not, it's not in play. So what I'm showing you right now is where we're moving to, because we've realized that information from the Community Advisory Council doesn't always flow, and they don't always necessarily get the answers they want, you know, in a timely manner or hear what they want. So this is, we feel, is a better system to put an intermediary there so that they can have more contact with the community tables and more decision making about what moves up the chain and needs to have a higher look at. Does that make sense?
Yeah, that makes a lot of sense.
Okay.
So it'd be cool to hear, circle back to you and see, like, you know, how the regional advisory panel, how the community group, the bottom layer, really hold the RAP accountable to getting
Yes.
things up to the top. So
100% agree. Thank you. Next slide, please, Susan. All right. Well, that's the end of my presentation. I just want to give you a short snippet of, you know, some of our community engagement strategies, the way we look at it from Elevate Health, and then a nice slide about, you know, what it looks like in real time in terms of structure. I'll leave you with a small poll that you'll take, and then we're going to transition to Lauren Fulton, who'll be speaking about our One Pierce model. And feel free in the meantime of transition to ask questions, put something in the chat if you feel so compelled. Our question is, if you could imagine the greatest outcome for your community engagement efforts, what would it be? Community-led initiatives, community ownership of a certain process, higher utilization of services and products, a better flow of information, or other, and you can put in what it would be. Thank you guys for participating. I hope this information was valuable. Hope you took one thing away that can help you in your projects and in your process. And thank you.
Okay, I'm going to give it a couple more seconds and then share the results. All right. John, I think you're on mute.
All right, we have some results in. 44% of you said community-led initiatives would be the greatest outcome. 52% of you said community ownership of a certain process would be the greatest outcome. 12% said higher utilization of services and products, and 32% said a better flow of information. That's a very, very good kind of varied group. And you see the outcomes of our endeavors. We all want different things. So like I said, alignment when you're going through this process is very important. Thank you. And feel free to look at these results and, you know, jot them down, because I think this is a kind of critical, and it tells something about our efforts and our strategies and how you guys approach it. So thank you. Enjoy the rest of the presentation.
Okay, thank you so much for that, John. I am happy to be talking to you all about community wellness funds, and in particular, One Pierce Community Resiliency Funds. We have a couple more polls embedded in here. We're also going to have some time at the end for you to discuss this, and I think also discuss anything that came out of John's presentation as it kind of sits with you through this, and you have other thoughts about it. We'll definitely have a little bit of time at the end just for some discussion. And I think to hear a little bit from you all about your experience as well with the sort of both community engagement angle and some of this aligned funding, which is what I will be talking about here as well. So one thing I'll say about the title of this session and thinking about sustainability is that Many people latch on to funding and this idea of a wellness fund or aligned funding as something which can be, yes, this will make our activities and our business and our whole organization sustainable because it's all about funding, right? And I just wanted to flag that there are kind of two ways to think about sustainability here with the wellness fund. One is about diversifying funding sources for your current activities as an organization and having potentially a sort of pool or entity which different funding sources can come into and help fund your existing activities. But the other way to think about it is how can your current business activities be sustained through an entity like a separate fund, which funds other organizations in the community to continue on that work. So in that second sense, we're not really talking about a wellness fund as a way for you to have more revenue to cover your own operations. It can be that, but what's more likely is that many of these wellness funds are actually funding other organizations in the community, and through that, the mission and the work that you are doing is sustained by funding other groups. So that's a slightly subtle distinction, but I think some people approach the wellness funds looking at it as a fund development strategy, whereas, as I'm going to share a little bit of, we think about it partly as fund development, but really also as an activity of Elevate Health and how Elevate Health continues to fulfill its mission in the community by funding these different groups. So we can come back to that if that's not clear. But to kick us off, we're going to have a poll. So I think it's on the next slide, as well as it's going to pop up for you all, which is, how is your organization's work funded? You can check all the ones that apply, because I know that many groups are funded through multiple sources. But I'm always a little bit curious about this when I work with different organizations, because I think it helps to kind of level set, to use that word or that expression, level set conversations around what your own organizational sustainability looks like, and what you really need to have in place for the future, depending on your kind of primary funding source. So hopefully you're answering this question now in the poll. We'll give it a few seconds as well, and then I'll let Susan kind of close out the poll whenever it looks like there are enough responses.
We'll give it a couple more seconds. And you should be seeing the results now.
Great. Okay, so we have the majority here from philanthropic funds and grants, which is very common in the nonprofit and particularly the charity sector, of course. This is primarily how many organizations are funded. A close second, though, with public sector contracts, and I think that is a reality of quite often the nonprofit sector as well, is that very often we're now all delivering services for whatever our mission is. 7% through private loans too, which I find interesting, because that is one that generally requires a kind of larger organization potentially, or more secure revenue sources sometimes to be able to get those loans. I'm interested in the other category. For those of you who put other, would you be able to share in the chat or come off mute and just say some of the other funding sources? Because this isn't an exhaustive list. I just wonder if there's some overlap in those of you who said other.
Hi, this is Amy from the United Way of Southeastern Idaho, and we have our employee campaign. So that's independent fundraising that our organization does, where money can be earmarked towards various projects like some of these. And that's been a huge just safety net for us. Thankfully, we haven't had to rely on it. And the majority of that money goes to community-based nonprofits, but it's always there in the background, you know, to, again, as a safety net.
That's great. Thank you. Yeah, thanks for sharing that. I think we're also hearing endowments, fee-for-service operations, Title V funding, local government funding, and some more kind of direct fundraising as well are ones that we're getting in the chat. I'm going to venture a guess that the majority of you probably put multiple funding sources here, which again, I think is just the reality of how we all operate. But it's also something that I will say is a useful part of a wellness fund. And thinking about having an entity, whether separate or not, that kind of pools funding together, is that it can be one way to diversify revenue sources, because you can be approaching private funders as well as philanthropic funders, and talking about using this entity or this kind of vehicle as a way to pool resources together and really align the funding in that sense too. So we'll talk a little bit more about that now. We can move to the next slide, please. So just to introduce One Pierce a little bit, One Pierce Community Resiliency Fund is one of the three business lines of Elevate Health, in addition to its data platform and its care continuum network, which is care coordination services. One Pierce is really the community investment arm of Elevate Health. We are a separate 501c3, but very closely held to Elevate Health. So we share board members in common, although we do have a separate board. We kind of have a separate budget, but it's also approved as part of the overall Elevate Health budget, or at least their contributions are to it. And so we do also have some funding from Elevate Health. However, as I mentioned, one of the benefits of having a separate organization is that it can really put itself out there to say, we are, through this entity, blending and braiding different sources of financing, all in fulfillment of our mission and our vision. And so we do that with One Pierce. It started out fully funded by Elevate Health, and over the years, we have been bringing in public sector funding and private sector funding and some philanthropic funding and grants as well. So that we're now, I think we're about half funded through Elevate Health at the moment in terms of our overall numbers, but those other sources of income and revenue are kind of creeping in and creeping up more and more as we go along. So that's just to put it in the context of what Elevate Health does. So it is absolutely part of the same mission and vision that John was talking about, with all the different values that Elevate Health holds near. But because of its different work and its operations looking different, it does actually have the separate branding, and again is a kind of closely held subsidiary or separate company. If we can move to the next slide, please. So our vision, again, in common with Elevate Health, is that every person in the communities we serve lives a full, healthy, and vibrant life. Our strategy for achieving this vision is to focus on 2 to 3 social determinants of health each year, to prioritize those social determinants. So for 2021, they have been affordable and supportive housing, behavioral health, and workforce development. Speaking about community engagement, as John has kind of set the stage for some of this already, many times those priorities can and kind of should be set with reference to what the community is saying the priorities are. I think it's an interesting point that Anna had raised about what happens if you have community members who want to prioritize different things too, and we've come up against that a little bit as well. You know, maybe our priorities for this year don't match what some community members are saying, but how do we make sure we're using both data and community input to make sure that we are selecting our priorities and our real focus areas to help fulfill this vision? The One Pierce activities and what we do within those priority areas is all about providing funding. So we offer grants, we offer community loans, and then we have this third bucket called Health Innovation Funds, which is really about supporting transformation of the healthcare system as a whole. And these can be catalyst dollars where we try to bring in other funders or investors into a project. But what's most important is that in this final kind of bucket of activities, we're really doing that work, co-developing the projects along with the community, hopefully, but also our Elevate Health colleagues. And so when I talked at the beginning about sustainability and what it means, these grants and community loans that One Pierce gives out are really sustaining the mission of Elevate Health by funding partners and other organizations who are helping to improve all of these three kind of social determinant areas that are flagged here. That third bucket about health innovation funds can be seen more as a sustainability strategy for Elevate Health itself, because we are working with Elevate Health and potentially putting funding into Elevate Health spearheaded projects that help to transform the system. So that's how we're set up. We didn't really have any models for how we can do that best and how we can be a sustainability source both for Elevate Health and the larger community. This is just sort of what we've landed on and what has felt right for us. I'm sure there are many other ways of doing that though. But we do at Elevate Health talk about One Pierce as one of the sustainability sources. And so I just wanted to make really clear what we mean by that. And then we also engage in capacity building and some advocacy and education for whole person health at all. I do see a question from Lauren about how do you work with community to identify specific goals within each of these three priority areas. So I will say, as you're hearing from John, I think our work in terms of community engagement is shifting and becoming deeper as well. So these priority areas were actually set for 2020 and 21. I only put 2021 here because it's the more relevant year for us right now. But that means that 2 years ago when we were starting this work, it was only through conversations with the community, and they were not formal conversations per se. So there was a little bit of knowing what the CAC was focused on, the CAC being the advisory council that John talked about. And then there was a lot of one-on-one conversations, which were not done in, to be honest, like a hugely structured framework or way. And I think that's one real opportunity for us for going into 2022 as well, would be to say, how do we do that in a more, not necessarily even streamlined, just a more structured process this time so that we can come up with a framework for how we engage the community in these priority areas. That said, we do also rely quite a lot on data here too, and we particularly look at our community health needs assessment, which is done by our local health department and partners in their kind of 3-year planning work. And so we use that data too to be part of the rationale around how we select these areas. Hopefully that answers that question a little bit. We can move on to the next slide, please. So those 3 areas in particular, I wanted to dive a little bit deeper into because this may look familiar to most of you. If your organizations have a strategic plan, you might move through these areas to say, like, what are our goals? What are the outcomes? And then in fact, our actual kind of spreadsheets and documents for this go deeper into how are we measuring this? Or sorry, what are the metrics that we're using? And then how are we actually measuring that? How are we getting information on those metrics? But for now, I just wanted to share that within housing stability, our goal is that all people in Pierce County will have safe, stable, and affordable housing. The outcomes that One Pierce in particular is looking for is increasing the numbers of affordable and supportive housing units and increasing the numbers of tenants supported with rental and mortgage assistance. That last one has been huge in the era of COVID, and in fact still continues to be a much larger than expected kind of activity area for us. Within behavioral health, we want all people to have equitable access to services supporting a healthy lifestyle. And the outcome is that we want to increase capacity of existing provider organizations to support their growth. And in workforce, we want Pierce County to have a robust community of skilled and culturally competent health professionals, importantly, who reflect the communities that they serve. And our outcomes there are supporting existing underrepresented providers to advance their skills and credentials, and increasing the number of training and education opportunities. So we then drill down into metrics, and we then drill down into how we measure those. The reason why I bring this up, even though it doesn't necessarily have to do with funding, is because one of the things that I'll say around thinking about your own funds or whether you want to develop a fund is that maybe 90 is a bit high, 80, 75% of the work is getting the framework in place. And this part about strategies and what is it that you're actually trying to achieve through funding is a huge part of that. And that's going to set the foundation for all the activities, and really comes before even thinking about what type of funding you would accept into a community wellness fund. So if we go to the next slide, please. One Pierce activities. So as I mentioned, with our kind of sources of funding, we do use One Pierce to blend and braid different funding sources. So we do have the Elevate Health funds, and we have some philanthropic support, public sector contracts. We were kind of fortunate enough to be in position and to have the connections and the kind of trust with our local county last year to be able to pass through $1.5 million of CARES Act dollars for behavioral health providers last year. So that sort of federal funding has in a couple different ways trickled through, and we've just been in a kind of position to luckily be able to just sort of pass it through to other provider organizations. And then we also do have PRI, which is program related investment, which is essentially a very low interest and mission aligned loan with a private funder as well that we can draw on if we are kind of deploying all of our funds. And again, those uses of fundings, we have the 3 different programs: grants, community loans, and health innovation funds. So this kind of sources and uses of funding really has to match up with whatever it is that you're doing. I'll focus a little bit on the lending program because it is different than what many community wellness funds actually do. Quite often wellness funds are seen as grant giving entities and organizations, and they have a huge amount of benefits, including aligning funding, including bringing together different funders and having a more streamlined process for grantees. There are many reasons why you would want to develop an organization that can give grants. However, if you're interested in loans, community lending is an entirely different sector in a way. There are CDFIs, which some of you may know, which are community development finance institutes, which really specialize in a lot of community lending. CSH on the phone is a CDFI, or if they're on the phone, one of the mentors is a CDFI and does a lot of community loans around supportive housing in particular. And it's a very kind of specialized area of knowledge. So if you are interested in doing something like this, one of the pieces of advice would be to bring on board someone with that kind of community lending knowledge. It also really matters to know what your funding sources are and how you're going to be using those funds to match them up effectively. So if you are taking on private loans, even if they are program related or mission related investments, you have to repay those. So you cannot be giving all of your money away as grants, or else you're going to be in trouble because you won't be able to repay your own loans. And so you can really only accept loans if you have some money going out, which is also going to be coming back to you, so that you can match up those funding sources. And this, to me is really fun to match these kind of sources and uses and how are we taking money in and what are we using it for. But this is one of the more, not necessarily complicated, but One Pierce does all of these things. And so it can be using all of these sources and using them for all the different purposes here. You could just take one or another pieces of these, right? You could just accept grants and public sector funding, and you could have grants going out the door and maybe some contracts going out the door as well. You can leave lending alone entirely if that's kind of easiest for you. But this is what a lot of that groundwork again is kind of set up around. So we have one more poll, which actually connects very much to what I'm talking about here, although it might not be immediately obvious, which is, what do your local nonprofits or providers need money for? So do they need money to cover existing operating costs? Do they need money to expand their operations, to purchase new buildings and purchase equipment, or to build up their reserves? And of course, many of them will have other needs too, but are there certain needs that you can think of that you have had local providers coming to you around. So we'll just give this a minute for everyone to respond. Susan, do we have some good responses in?
Sorry, I was having a hard time finding my mute button.
You're
Yep, I'm
fine.
gonna go ahead and close the poll. I think we've got some good responses.
Excellent, thank you. Yes, and echo what Susan said in the chat. If you said other, feel free to share it out in the chat. So covering existing costs and expanding operation are the two largest ones, which is not surprising at all, again, given how kind of hand to mouth a lot of the organizations that we work with are. One thing I will say is that the types of activities that you plan to do with your wellness funds and the type of money that you want to take on really should relate to what the needs are of your local community and the local nonprofits. So this is all getting back again to John's presentation and community engagement, because it's really about knowing those community needs. Loans can be used for certain things and they can't be used for others. It is very difficult to use loans to cover existing operating costs. Lines of credit would be a bit of an exception here. But in general, you're not going to be taking on a huge loan as an organization to make up deficits in your forecast if you don't have a very robust model of revenue coming in to help you repay that loan. And you're not going to be taking it on, not because you don't want it, but because probably banks aren't going to give it to you. And so loans can be used very effectively to do things like purchase a new building or purchase equipment, because in that sense, you do actually have an asset, a tangible thing that you can kind of secure your loan against. So knowing exactly what needs your local nonprofits have can also help you to decide what sort of funding you should be putting out there into the community. You can bring in millions of dollars of loans that you take on as an organization and plan to give out millions of dollars of loans. And then you might find that that's not actually what your community needs. And then you're stuck in a position of not being able to use the money and maybe even having to pay for the money if you've already drawn it down. And it doesn't help anyone, even though in theory you've raised millions. So everyone's excited about the money. And I think what I usually come back to is the money doesn't matter if there's not the places to put it, and if there's not the kind of places that will give it back if that's what it needs. So that's just a kind of quick overview of how to determine, I think, through that community engagement exercise, really, what the financing needs are of local nonprofits in your areas and how that's going to affect what kind of money you should or could be bringing in and then offering out to them. So if we can move to the next slide, I wanted to share just a few of the impacts because I'm really proud of One Pierce. We kind of officially launched from an operations standpoint in January 2020, which, you know, as you all know, 2020 didn't go the way anyone expected. And as a fairly new entity, we managed to evolve very quickly in response to many of the COVID needs and a lot of that federal funding as well coming in. So our sort of impact sheet for 2020 looked like us committing $5 million, which was what we'd started with, 4 million of that, in fact, from Elevate Health at the beginning, and leveraging that money with partners through 21 grant agreements and 2 loan offer letters and 8 promissory notes, which are the loan notes as well. And those were in particular for bridge loans for providers who were delivering services under contract but who needed the money up front to be able to actually deliver those services prior to being reimbursed through their contracts. So the kind of impacts there around affordable housing, you can see around households supported with rental assistance and behavioral health. Those grant agreements were all for behavioral health providers. They were for very different things, so we had some trouble tracking metrics there, but in general, we were pretty pleased with the kind of support for more diverse clients and outside of the urban areas, in particular within Pierce County. We didn't get to workforce development in 2020, and that's something that we're aiming to change in 2021, but this is just the reality of how these things happen sometimes. And on the next slide, you'll see our kind of year to date for 2021 numbers as well. We have expanded some of these programs. We have our first workforce development work in progress now, and we hope to kind of commit money to that within the next month or two. So we are growing this year, which is very exciting, and there are kind of tangible ways to be looking at the impacts that we have, which all links back to those strategic pillars and what is it that you're actually measuring and tracking, and how does that help achieve your goals. So on the next slide, we will talk about reasons you might like to do this. Again, like I said, with One Pierce, we set it up for a couple different reasons within Elevate Health the way it is. Ones that you might want to consider. If funding other organizations is already part of your business activities, but maybe not the whole part of your business, then maybe having a fund, separate or not, is a way to align other funders with your interests and your funding priorities and bring more people into it. That's also related to diversifying your revenue. If this could be a way to say that you want to blend and braid different funding sources into an entity and look at that private funding as well as public funding and philanthropic funding. Or on the flip side, if you are already working with a whole coalition of funders and you're all thinking, we're doing all this work separately, we need a place where we could just streamline the whole process, that would be another reason to think about a fund. And then also, if you do have some kind of community needs which are really around grant and loan support or other types of funding, then you can think about a fund as a different way to be addressing multiple types of financing needs, and maybe do it through a kind of more specialized form. So I do have a couple other slides that I could talk about that are really just steps to think about when setting up your fund once you've already come to the conclusion that you would like to do this. And I think some of our mentees have seen them already. But really, I don't know how many of you are considering doing this or are planning to do this. And so I don't want to bore you all with those considerations if it's not something that you're interested in. So it is coming up to 2 o'clock Pacific, and the cross-cohort webinar survey has popped up. So if you all want to fill that in as you're sort of exiting, technically we have another 15 minutes, and I think we would love to hear from you all in terms of responses to these presentations. Both of them, both John and I would love to hear about the community engagement and the wellness funds piece. And in particular, I'd love to hear if you think your organization already kind of operates as a wellness fund or has some kind of aligned funding attached to it, or if you're interested in setting that up. And then we have a little bit more time to dive into any specifics that you all want to raise. So I will pause there and see if Anna or Susan, if you want to say anything about the exit survey or where we are, we can do that.
I will just quickly chime in. We understand some of you may have to drop off right now. So we are going to go until 15 past the hour. So if you would like to stay around, that's great. If not, we totally understand and would just appreciate your feedback on how this went for you. So if you want to stick around, we'll be here, and you can minimize your the pop-up survey that came up and come back to it later. So that's all I wanted to say. So Lauren, you're good.
Great. So do we have kind of questions or comments from anyone on your experiences with either the community engagement or this wellness fund piece of the work? No, I know one of our mentees who is setting up a wellness fund at the moment. But do we have anyone else who is kind of doing this work, or has anyone been kind of tempted by the wellness fund work before and thought about it? I'll just let the awkward silence drag. That's what you got to do with webinars, unfortunately.
And Lauren, feel
If you
free.
don't, if you don't mind, I'm happy to jump in with something that I think is a side issue for you, given what you're asking. And if you're open to that, we're a total newbie doing this. My name is Jim Peterman, and I work with South Cumberland Health Network in a rural county. And we're sort of trying to jumpstart data to action programs. And it was Lauren's presentation that I was listening to, and the part that you didn't talk about, which was setting up metrics. I got the whiff of, and I'm sure there's commonality between all the sorts of strategic planning and assessment models that you might use in these different programs. But I had a feeling about this being the results-based accountability model, which we've had presentations on before. And I thought, this seems so practical and common sense oriented, starting off doing data to action programs with communities that haven't been working that way. It seems to me like a no-brainer to kind of do that. And I couldn't tell, from what you were saying exactly, but I was wondering sort of what kind of frameworks do you work to get from the point where you're setting up your goals to figuring out what your metrics are going to be?
Yeah, that's a great question. And you're right, there's a lot in that in terms of how we work organizationally. So you're also right that I've done results-based accountability kind of training before, and I think that's part of my framework in approaching these and looking at outputs and outcomes and impacts and all of that good work. We had some of that selected for us in a sense that as an organization, Elevate Health kind of started life as an accountable community of health within Washington, which I know we have other ACHs here as well. And so many of the metrics particularly around healthcare, were kind of predefined in a lot of the performance and performance goals and metrics that were part of the statewide legislation that set us up. So that was really interesting from the perspective of having some metrics to start out with, but in some ways they were way too detailed and quite often quite clinical for what One Pierce as a fund was looking at. So we had the fun approach of saying, all right, when we're looking at social determinants of health, which of these metrics really make sense? What other frameworks can we look at as well? And I believe firmly in not reinventing the wheel. And so we looked at the Healthy People 2020 framework. I think that's what it's called, the kind of federal framework around metrics. I looked at kind of a couple meta-analyses of different metrics for social determinants of health frameworks. And really started from that perspective to say, what is already out there in the literature? Part of the reason for doing that was so we could benchmark ourselves against what others are doing. And, you can only do that if you're collecting the same data, of course. But then the flip side and the bottom-up approach, really, and this again gets back to community engagement, was using 2020 as our kind of first year with real borrowers and grantees to say, what do you already collect? and what is not going to be adding too much to your plate to ask you to be measuring in terms of data. And so we came at it from both ways. It was a little bit of a compromise between what's best practice and what's out there in other frameworks, and then also what metrics are already collected and how can we come to something in the middle and pick just a few. We don't have a huge amount, one or two, well, 2 or 3 probably for each of those 3 pillars that we wanted to make sure we were tracking across all of the groups that we fund. So that probably only partially answers your question, but it was a learning process for us, and I think one that we're still in some ways undertaking every time we talk to the groups that we fund to say, what is it that you collect and what do you use?
No, that I find that really helpful, and thank you. And just one more question. So, so when you're working on grants, do you specify what the metrics are, or let the grantee specify that?
Yeah, so this reminds me of something I wanted to say in response to your first question too, which is from a strategic plan level, we did spend a lot of time figuring out what are our goals, what are the outcomes, what are the metrics, how are we going to measure them? My job has then been to translate that to, on one hand, work plans. You know, how do we make sure that everyone who I work with, at least within One Pierce, and I think, you know, we want to do this across all of Elevate Health, how can we make sure everyone sees how their own work actually relates to the overall organizational kind of metrics? Because that's how people feel like they are making a difference, that they can see the difference that they're making and having an impact. But the other piece of it, which is what you're asking about here, is to make sure that that strategic plan and the metrics are not just related to work plans, but are in fact related to contracts. And how do we make sure that our grant agreements or anything we're asking for from our borrowers or on the Elevate Health side from the contractors are actually helping us to fulfill, again, the mission and vision and all that. So we have, the approach that we have right now with One Pierce is to have a discussion with our grantees about milestones. So we make milestone payments. So we go through their individual projects or whatever it is that we're funding, and we say kind of what makes sense here to fund. How do we get milestones around outputs and around impacts? But at the same time, with every invoice that they submit for one of those milestones, there are certain metrics that we collect across all of them. And those do include the metrics from our framework. They're, again, pretty simple. So there are some demographic information in terms of the clients or services provided around age, race, ethnicity, zip code, and one other that I'm forgetting right now. Gender, that's what it is. And then we also have the 2 or 3 metrics from the strategic pillar that make sense for them. So within our behavioral health grants, we have the 2 or 3 behavioral health metrics. And within our workforce development work, we're going to have a couple other metrics that we ask them to submit every time with their invoice. That's how we've structured it. So we'll see how well that works this year, but I'm hoping that we're going to get higher quality and better data capture by having it be part of the invoice process.
Well, thank you so much. I'm impressed and also feel more confident that I might be able to jump into this arena.
Great, well, thank you. And feel free to ask any more questions as well. We do have a couple more questions in the chat, but feel free to unmute yourself, anyone, if you'd like to chime in as well. With the shared regional governance model, do you think your desired future state of this model may change as the Medicaid transformation project objectives change? Yeah, so there's another ACH on the phone. Hi, Caitlin, who is also playing with the sort of whims of what is happening with the waiver work right now. Which for those of you who are not part of the ACHs is the primary funding, if not the primary funding source for ACHs. And as I think to make this applicable to everyone, as government priorities change, how much do we all change alongside to meet them? And so I think we're still grappling with this, Caitlin, right now. I think We know there are some things which are part of the Elevate Health model, which have always been part of the Elevate Health model, that care coordination work and the data work and this wellness fund work, community resiliency fund work, which we will absolutely be pushing through to whatever the future state looks like. And then I think within that, there is room to say, can we focus and prioritize some of the work that becomes new priorities of government? Workforce development has been one of those areas that, as I mentioned, has actually been a one Pierce priority since 2020. We didn't do much in it in 2020. In 2021, we're just scratching the surface, and now we're finding that that looks to be, at least last I heard, a sort of priority and area of focus for the potential additional waiver. And so that's something that we really need to ramp up. So I think it's a question of ramping up and ramping down different priorities, and then just really trying to stick with those parts which have mattered to us all along. But Caitlin, I would actually love to hear your thoughts on that too. I'm not sure if it's relevant for everyone, but we can always take it offline as well.
Yeah, no, I think that's the same thing we're grappling with as well. We're trying to move to more of a distributed leadership model and focusing on, like, we went through this whole strategic planning process that I'm part of on the board. And then we were like, oh, wait, like, how is this going to be affected by this potential new application? Because we were really at first trying to shift away from being this kind of transactional partner and looking to be more of a neutral convener, but knowing that the ACH is that many of us are staying around and money is always going to be funneled through us. So how do we, like, make that balance? But then with this new application period of not knowing what's going to happen, I think that there will be some parts of the transformation projects that hopefully we'll be able to, like, say yes to and say no to, because many of us are kind of going through this phase of, like, seeing what would fit better and focusing less on just Medicaid transformation project and more of our whole community as a whole.
Absolutely. Yeah, and I think that is really relevant for everyone who has government funding as well. You know, how much do you respond to things and how much do you stay your course? All right, well, I know we have only a couple minutes left. I don't know if there are any other questions that have 1 or 2 minute answers, or Susan, if you wanted to say anything else.
I think I just wanted to say on behalf of the DASH program office, and I think on behalf of the mentors, thank you for your participation. And thank you, Lauren and John, for sharing your insights. Thank you to everyone for participating and also providing feedback on this series. This is the first time we've done something like this, so it really will help inform future planning. I think just to kind of close this out, yeah, I will send a follow-up email with the slides from today, as well as any resources and information on the All-In National meeting and some of the funding opportunities we announced today. And as you know, there's still a couple more weeks left in the mentorship and itself. So in that time, you're always welcome to reach out if you have any questions, whether it's about closeout contracts or if you would like to be featured in an upcoming DASH blog about what you've been working on. All is on the table. So thanks again so much. And this recording will be on here too. So, all right. Thanks, everyone.
Thank you all. Enjoy your afternoon.
Take care, everybody.